I've been in practice 38 years with a passion and a love for medicine and a passion and a love for helping people. I feel this is a holy occupation I have that I really can make a difference in people's lives. And I work together with the patients and the family to be on top of everything, to provide emotional support and proper medical attention, primarily for prevention. Too often, people start taking care of their health seriously after they've had a problem, and it's already too late. My ambition and goal is to get to people early and motivate them.
Preventative care is something that most people don't think about enough. And it's something that you need to start to address as quickly as you can. Many times you don't feel diseases creeping up. People think that maybe a key marker will get out of place, or they'll wake up with chest pain and they'll know their heart isn't doing what it's supposed to do. But prevention is about making sure that you never get to the point where you have discomfort. Prevention needs to start now. And you can do preventative medicine in a very simple way by looking at movement, diet, stress management, and sleep. And it's something that nobody offers, and 80% of your effect for your life is measured by how well you do preventative care. Here, we offer all of those services. It's extremely unique. It's something that you really should ask us about. We'd love to talk to you about prevention. One of the main reasons that people have medical errors is miscommunication. When a doctor has to put something into a system, and then a nurse has to go into that system and read it, and then they have to communicate that with a broader care team, things can fall through the cracks. What we do here is we communicate together, one team, one plan around the patient, and we talk directly one to the other, and we get the plan going forward for you so that you know exactly what you need to do. There's no miscommunication, there's no misalignment.
I was looking for a program that my primary physician would be involved with other disciplines altogether. So it was involving lab tests, plus a dietitian, plus a trainer, and there's a person with a health coach and a doctor that oversees all together. So they're covering all areas. I realized that just to have a diet is not enough. So I was looking for something more wholesome that will see me in a bigger picture of things in all areas.
4 years ago, I was not taking care of myself well. I didn't care. I wasn't motivated. I weighed 275 pounds, and I was heading to a heart attack. I became motivated through my lovely family and friends and my own intelligence to start taking care of myself. And over 3 years, I went from 275 pounds to 195 pounds. I was stuck for the last year at 195 pounds, and I felt I had to do something a little bit different. And I became part of the concierge care, which emphasized better nutrition, more protein, more water, more sleep, and more exercise. And on this program for the last 2 months, I've gone from 195 pounds to 188 pounds. And my whole way of eating is different. I'm very regimented. I have a nice breakfast. I have proteins. I have a protein shake. I have a smaller lunch with fish or chicken, a smaller supper, and I'm satiated. I'm not looking to snack. I'm not looking to eat extra. I'm coupling that with proper exercise, because with loss of weight, my muscle mass went down as well. And I just feel much stronger and much healthier. And this is something, I don't feel it's a diet, something I can continue really for the next many years. So I've personally benefited from this program. And even though people may think they don't need it, they do need it. And I'm an example of someone who's in a short time has made an extra difference by following the program and having proper counseling.
So lifestyle medicine is a fully integrated field. You absolutely need to continue your medical recommended procedure and medication from your doctor. But in order to optimize lifestyle medicine, there are key pillars. The key pillars revolve around nutrition, movement, sleep management, stress reduction, social interaction, and making sure that you don't do anything that's very bad or dangerous for your health. When you practice good habits in lifestyle medicine, people think that they're optional. They're not. These aren't nice to haves. These aren't extras. Lifestyle medicine is proven to make sure that you're as healthy as you can be for as long as possible. If you'd like to know more about lifestyle medicine, ask us.
The prevention program brought in a trainer that said, no, you have to also worry about weights. I never did weights before like that. So they introduced the weight program for me that did an amazing thing to my body, my posture, and my mood, my mood and energy.
I always feel like I'm an old-time family doctor in a modern jacket. I want to spend a little extra time with people and not be rushed and make myself a super concierge doctor. And many people think they don't need it, and that may be the case, but for people who need extra time and extra caring and extra maintenance, this is an option. It's not for everyone, and that's why I have a hybrid practice. And anyone who doesn't feel strongly that they want to be part of this doesn't have to, but there are many people who would benefit from extra care, extra experience, and extra time from myself. You will get the end result of appropriate medication and appropriate testing, but being in a more relaxed environment and spending more time and having full undivided attention will allow the experience to be enhanced. In addition, we're coupling with nutrition counseling, exercise counseling, and extra services and extra testing that will make the medical visit a more enhanced one.
Most people go to the doctor once every 6 months, and you get your standard labs, and they tell you that you're fine, hopefully, and you go home. What's extremely important is to have constant feedback and to have a team that's working around you to be able to implement that feedback into your day-to-day life. So if you leave the doctor's office and the plan isn't working, we should know quickly. You should know quickly, and we should be able to make adjustments by working as a collaborative care team, having everybody sit around a table and talk about the patient and their needs in real time. You don't have to wait. You don't go 6 months without doing the wrong thing or without making sure that you're acting in the best accordance with what your health requires. So ask us about how we collaborate with you to give you faster, more agile and adjustable plans that will get you healthier and make sure that you're getting what you need and not sitting on bad guidance for a long period of time.
I've been very fortunate to be in medicine. It's the greatest field in the world where I interact with people, I get to know people, I get to know the families, I'm personally involved, and I can make a difference. And that's why cardiology is the greatest field, because over the past 40 years, there have been so many major advances. In the 1940s, the only medicine we had available was nitroglycerin. Franklin Roosevelt died in 1944 of uncontrolled hypertension. In 1955, Dwight Eisenhower had a heart attack, and there was nothing to do for him other than sit around. But beginning in the 1960s, we developed new medications, first beta blockers, then calcium blockers, and then ACE inhibitors, and then statins that have changed medicine. In the 1960s, we started having heart-lung machine to do bypass and valve replacement. Subsequently, we've had perfection or improvement in pacemakers and defibrillators. There have been advances in stents and in surgery and in TAVR that we spoke about. So there's really no greater field to make a difference than cardiology. And I've been very fortunate to be part of this for the last 38 years. And I want to continue to be involved in this the way that we've done with great patients, and every day is fun.
I felt first that I was stuck on a certain weight. I could not get lower than a certain weight, and I wanted to lose at least 5 more pounds. And I couldn't, no matter what I did. I thought I'm doing good, healthy diet. I thought. So this was the number one reason that I wanted to lose the weight responsibly. And the second thing that I wanted to have more exercise, because the first time I took a weight loss program was a program that they did not address at all the exercise. And not only I lost muscle mass, but my skin became a little saggy. in my arms. So I was like concerned, I don't want to do that. So when I found that they have a combination of exercise and diet, I chose this program. I thought it was very, very good for me.
4 years ago, I weighed 275 pounds. I did not exercise. I did not take care of myself. I wasn't careful with my own personal health. And I always felt whatever happens to me will happen. But over the last 4 years, through medication and guidance and love and good relationships, I've been able to lose weight from 275 pounds now to 188 pounds. And my cholesterol level has gone down, my sugar has gone down, my blood pressure has gone down. I feel I'm able to motivate other people to do the same for primary prevention because I was able to do it. And when people say it's not possible for me to lose weight, I say that was me, but it is possible. 4 years ago, I did a calcium score on myself and a CAT scan angiogram, and I was full of plaque. I was worried that my demise was going to be soon, and therefore I really got motivated to take care of myself. Good health is multifactorial. One factor is taking medications, but other factors are proper diet, proper exercise, proper sleep, proper sunlight, and stress reduction. All those factors go hand in hand with controlling your blood pressure, controlling your cholesterol, and taking care of yourself properly.
Almost everyone thinks they know what they need to do for their own health. Board-certified health and wellness coaches make sure that you take the things that you probably know and you actually acclimate them to your day-to-day life. They're experts in motivational interviewing, on creating vision and values, and really making plans that work in every aspect of your day. They're not medical professionals in the sense that they'll diagnose you. They help you make changes stick in your day-to-day life. If you'd like to know more about how board-certified health and wellness coaches can help you and how maybe you can get access to one, we would love to help you. Please ask us.
The standard lipid approach has been proven to be wrong. When one goes to the cardiologist up until the past few years, you would receive 4 results: cholesterol, total cholesterol, HDL, LDL, and triglycerides. And from that, one would decide if one needs statins or other medications. Now there's a whole new advanced lipid profile, which looks at apolipoprotein B, apolipoprotein E, homocysteine, C-reactive protein, inflammatory markers, and subtypes of LDL. It's very important to understand not just your total number, but the breakdown of your lipid panel in order to more aggressively treat heart disease and prevent problems. Without doing this test called advanced lipid profile, one is in the dark ages.
The health coach, which happens to be Deborah, that she called me, and it's all on the video, Zoom, live. So I got to know her, she got to know me. And then with a dietitian, same thing. I could also show her things on the video of what I have in the fridge, my own fridge. I would say, what is this? Can I have this? Can I not have this? How to eat it? And the same with the trainer who sent me videos, and she spoke to my trainer. She didn't tell me, get rid of the trainer. You can also do it by yourself with my guidance. And I would follow the video every day of what I was supposed to do. And the trainer enhanced it even more for me.
Now, over the past 4 years, I have become a changed man, and it has tremendously changed my ability to be a physician and motivate people. Calcium score is a relatively new test that I feel everyone should have above the age of 30. The reason it's so important is it looks for early plaque that is developing, and the score goes between 0 and 2,000. Like golf, the lower the score, the better. And I always joke with people when they get a 0 on it, they did a great job studying for the test. But it's very important to know where you stand, because if the calcium score is high, and high is defined anything more than 0, one has to be on statin and change their lifestyle. But if you don't do the test, you have no clue where you are. A word of caution, however, which is a bit paradoxical. 14% of people who have a 0 calcium score can go on have heart disease because they have soft plaque. So it's not just hard plaque we're looking at, it's soft plaque. But it's important to put the whole picture together. But for the most part, the lower the score, the better. But it has to be ordered and results have to be discussed with your physician to discuss what to do to prevent heart disease.
So medical schools now are teaching food as medicine, and I think that that's a bold hypothesis. But what we do know for sure is that food affects key markers for everybody. It affects insulin sensitivity, it affects your cholesterol level, it affects inflammation, lots of things that are real for you. And if you get a food plan that is customized and personalized to you, and that's structured around your daily life, you'll actually have a chance of using and following through on that. And what we do here is we tailor every plan to every individual, and we don't just give them what they should eat, we tell them how to incorporate it into their daily life. So you're never guessing, and it's always clinically aligned. So that way, when you are making choices in the grocery store, when you're cooking yourself a meal, you know that you're doing the right thing for you and your long-term health.
In the past, one needed an invasive heart cath, which entailed dye and entailed radiation and entailed being in the hospital with multiple risk factors associated with it. A cardiac CTA is a non-invasive CAT scan of the arteries done through an injection of contrast through a big vein, and it gives an anatomical roadmap of the 3 main coronary arteries to determine how significant the blockages are. Sometimes someone has a high calcium score, but actually doesn't have significant blockages. And sometimes one can have a relatively low calcium score and can have on their roadmap with the CTA more involved blockages. So information is key, and it's important to get a real assessment as to someone's anatomy up to the heart, and then to fine-tune treatment.
After I saw what's happening to me, and I started to feel so good and energetic, I said to him, listen, why don't you try? And he actually saw me eating my meals. And so I said, why don't you start and eating like me and see what happens? And he actually liked it for the first time in a long time. He really ate a normal breakfast. He usually would run out to work and not even eat much. And he started to like it. He said, I feel satisfied. And when the dietitian showed me the protein drink, for example, I said, why don't you try it? He said, oh my God, I love this. He started it and he wasn't hungry for after lunch even. I said, why don't you try and do that yourself? And so he was encouraged to do it by me. I felt good, and he joined.
We hear about this class of medicine called GLP-1 inhibitors, which are commonly known as Ozempic or Mounjaro or Zepbound, and these are making billions of dollars for the drug companies, but really turning people's lives around. And the reason these are such novel agents, and it's done by injection once a week, it changes your metabolism. It works on the biliary system and on the brain to cut down appetite and smaller portions and help with weight loss. In addition, once there's weight loss, it helps lower the hemoglobin A1C, which is the long-term sugar. Hemoglobin A1C should be about 5.7, and these medicines work well in keeping your sugar and hemoglobin A1C under control. There also are benefits for the brain and for the heart and for the kidneys, and some say prevention of dementia. So lowering hemoglobin A1C, getting one's weight down are very important factors for good health and prevention.
Most people think that it's all or nothing, that you have to be perfectly healthy, and you don't. You just have to make the right changes, and over time they add up. So it could be one small thing that you do today that's different, and as long as you sustain that and it becomes a real habit for your life, that's going to get you much farther than a huge burst where you feel energized and great and it fizzles out. Here we have a care plan that helps you make small changes to build on the progress you make from those small changes and to create a long-lasting change in your health.
Hormone replacement in women is a very important topic. Women, as they go through menopause, their estrogen, progesterone levels drop down. For years, women have been suffering through menopause because doctors felt that based on preliminary studies, that it was dangerous to take hormone replacement. We now understand that's not true. It's very important for women, especially in the menopause age, to start hormone replacement. The only caveat is they need to have a mammogram to make sure there's no breast issues and have a gynecological exam. So the hallmark of treatment after you've done your calcium score and CTA is treating the LDL. LDL is the bad cholesterol. And then we spoke before about the LDL subtypes. But anyone with the LDL more than 100 who has plaque should be started on a statin. Statin would be Crestor or Lipitor. Those are the classic drugs that have been used for many years that have been proven to be helpful. But we know there are certain people both with primary prevention and secondary prevention. Primary prevention means avoiding the medical problem to happen. Secondary prevention means you already had a bypass or a stent. So whatever intervention is done doesn't change the underlying problem, it just turns the clock back. So some people need more aggressive treatment besides just the statin, which we call dual therapy. This new class of drugs, which is very potent, is called PCSK9 inhibitors, which examples would be Repatha or Leqvio. Repatha is an injection every 2 weeks, usually in addition to the statin. Leqvio is more convenient because it's done every 6 months. And using different mechanisms of lowering the LDL, it's been shown to quiet the plaque down and help prevent new heart problems from developing.
For me, it's very important that he's a cardiologist and internal medicine physician. He has an influence as well on a lot of people with his patients. Once he lost the weight, and let me tell you, he was 275 pounds. He's now 189. But not only the number of the pounds, he's strong, he's more flexible, he is walking, he is beamed, his energy at work is amazing. And patients see him and they ask, oh my God, what happened to Dr. Pianko? Some of them cannot recognize him. And what did you do? I want to do the same. So for me, it was important because it's a really main person to influence other people's health. And when you do, he's a cardiologist that does great with the testing, but the lifestyle, is we found out, is as important.
It's very common for people have transient loss of strength in their arm or vision. That's what we call a TIA, or transient ischemic attack. The difference between a TIA, a mini stroke, or a stroke is the duration of time. A mini stroke lasts usually minutes to hours and then resolves spontaneously. A stroke is more of a fixed blood clot to the brain that doesn't resolve and needs more aggressive treatment. But when someone has a mini stroke, it must be taken very seriously and looking for underlying causes as to what caused it so they don't end up with a real stroke down the line. Testing for a mini stroke would be to check your carotid arteries, check echocardiogram, make sure there's no blood clots, wearing a monitor, make sure there's no atrial fibrillation. Treatment usually begins with aspirin, sometimes with Plavix as well. But it's a frightening symptom when someone transient loses function neurologically, and it must be checked out.
You should start looking at preventative care right now, immediately. It's never too early to start doing the right thing. And as we age, what happens is we feel we can always get back on track, and maybe we can, but we can never get back to where we were a week ago, a month ago, or a year ago. What I would strongly suggest is begin to do preventative health today. Take measures now, and it doesn't matter if they're big or small. Start something, start now, and start where you are. We would love to help you to do that.
In a population above the age of 70, about 10% of men and women develop atrial fibrillation. A normal rhythm goes regularly, called normal sinus rhythm, bop, 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 with irregular intervals. Atrial fibrillation is irregular. And it's very important because this can lead to a stroke. When someone has atrial fibrillation, they have to be on blood thinners immediately. Usually we use something called Eliquis, and they have to have a cardiac evaluation. And it's important when someone first starts atrial fibrillation to try to get them out of it. Usually done with what's called cardioversion, which is electricity to the chest, or cardiac ablation. The important thing is if you feel you're rhythm changes to be seen by a physician. And if it is atrial fibrillation, it must be treated usually in a hospital immediately to prevent significant damage from atrial fibrillation.
I have this one patient that was very concerned about her weight and how she appeared, and we helped her very dramatically. But what the patient doesn't always understand is how losing weight might make them more frail and less resilient in their day-to-day life. What we found is that by giving strength exercises and mobility exercises along with a high protein diet, in her specific case, she was able to maintain strength and resilience. And even though she lost weight, she felt stronger, she felt better, she felt more active, and she could live a much more eventful and proactive life.
Men, as they age, become tired, fatigued, lose sexual function, lose motivation, and often when we check their testosterone levels, it's very low. A normal testosterone level should be 200 to 1,000. So in the individual who with a low testosterone, they would benefit from testosterone replacement. And it works together with, taking care of other medical problems like sugar and cholesterol and blood pressure to help revitalize a man. Women, however, you would think wouldn't need testosterone, but there have been studies of women starting to take testosterone and really changes their life. The heart has 4 valves, but the most important ones are the aortic valve, the mitral valve, and less important is tricuspid valve and pulmonic valve. But we'll talk first about the aortic valve. That's the main valve where blood is ejected out of the aorta to the rest of the body. With age, what's called aortic stenosis can develop, and that's calcium forming around the valve, so a valve can't open and close, and there is abnormal flow. Up until the last 10 years, it required major open heart surgery and a valve replacement. Now there's a new procedure called TAVR or TAVR that can be done from the groin, and it can correct the valve and be done with relatively low risk, and the person is usually in the hospital for a day or 2. It's an amazing procedure and is very effective, and is probably better than open heart surgery with a valve replacement. But it's important with aging, to be seen by your cardiologist and to have an echocardiogram to look at the aortic valve. There also is a mitral valve, which can leak, and also that used to have a mitral valve replacement, but now you can do something called a mitral clip. So these are relatively not easy, non-surgical approaches that can be done through the groin to correct these 2 very common problems as people age.
What you find with preventative care and with coordinated team care is that it's always necessary, and people don't realize it in advance. So we've had some patients, one in particular, who came in and wanted to lose weight. And he lost 25 or 26 pounds on the program. But what we realized was he was taking too much blood pressure medication, and his heart rate had changed too dramatically. We had to adjust with diet. We added fiber to his diet. We added water to his diet. We had to change his exercise plan because he was getting dizzy. We made sure that he could do things while seated and in bed. And together, because we have a team and we could collaborate around this patient, he got amazing results in the safest way possible and changed his life completely.
Osteoporosis is a problem we see more often in women, but also in men. With aging, the bones become softer. There's normal bone, and then there's osteopenia, which is less dense bone, and then there is osteoporosis. There is a simple screening test called the DEXA scan or a bone density scan that can be done to see one's relative risk of developing fractures with a fall. So often when you find people with significant osteoporosis, they are started on medications. In the past, there used to be something called Fosamax, which is a pill taken weekly, but now there are some shots done every 6 months. One is called Prolia, one is called Evenity, that strengthen the bones. So it's something that most people, or most women especially, should have done every several years to determine what their risks are for fracture.
Our office does internal medicine, family medicine, and cardiology, but nobody incorporates lifestyle medicine in terms of diet, in terms of exercise, in terms of stress management, in terms of sleep, in terms of social interactions. all the things that map to what actually make people healthy outside of the doctor's office. So typically you come to a doctor and they'll take a test and they'll say you're okay or you're not based on your labs. Here we look at those labs too, but we try and understand what is it that's going to make those labs move in 5 years. And if they move, which direction are they going to go in? Are they going to go in the right direction or in the wrong direction? We make sure that you have an entire team in place around you where you can eat the right things, exercise in the right way, sleep in the right way, and make sure that your cognitive health and your emotional well-being are fully taken care of. I can't think of a doctor's office that offers all of those things. They simply can't. People haven't put the team together in that way. People don't offer it, and they don't offer it under medical supervision. Usually, a patient is going to go and have to wrangle all of these different elements for themselves. You have to find a dietitian if you're interested. You have to find a trainer if you're interested. You need health coaching if you're interested. You need to figure out how to sleep on your own. Here, we bring everything together into one place. We offer it through the doctor that you know and that you trust, and we make sure that you're doing the right thing and you can have the peace of mind knowing that you're doing everything you can for your health. You can never guarantee a healthy outcome, but we can absolutely guarantee that our process for you is the best that you can get.